So the idea of a virtual clinic is where the patient is getting their information immediately. That information is also available to clinicians immediately. And it means for a patient who is well controlled and not having issues around hyper or hypoglycemia, that perhaps they don't need as much review in the traditional hospital or primary care setting as would have been the case in the past. So the idea would be that you see patients only when you need to see them or when they need to see you as a clinician, and that you have up-to-date records that you can access immediately, rather than requiring or depending upon patient journals and memory, which is often unreliable. So Cellnovo, because it's giving immediate feedback for data and it's accessible online so that patients can manipulate their data, they can see it in user-friendly type ways, and their clinicians can also do the same thing, means that the requirement for scheduled visits when they may be unnecessary is going to be diminished. So we see this as a much more interactive and patient empowering sort of system, which I think for the sort of technologically savvy patients is going to be a major advance. And I think it will put people in control of their diabetes rather than the diabetes being in control of them. I think the more data that people get about themselves, then potentially the more in control they can be. So we're seeing it with some of the new glucose sensors that give continual readouts. The same thing I think with Cellnovo technology, giving immediate feedback on things such as exercise, allowing you to integrate your carbohydrate input, and also seeing insulin dosing and blood glucose monitoring all brought together. So I think for patients who are sort of in touch and feel in control of new technology, this is a massive advance. So I think ultimately the artificial pancreas is the panacea, so a technological solution where insulin is delivered according to prevailing blood glucose levels and essentially taking the patient out of that loop. I think we're some way off having the perfect device, that's certainly the case. And I think it requires a sort of step change for individual patients in that they're handing away the control of their condition to an automatic device or a machine. So I think ultimately it's the ideal solution, but we're some way off, and I think it will take a step change in both technology and patient confidence for that to be widely adopted. I think it's fantastic that a UK company is involved in several large academic projects to lead towards the artificial pancreas. If I had type 1 diabetes, I'd be looking at that as the ultimate technology, and I think we have to support Cellnovo in their attempts to move this forward.